Hi everyone, I'm Dr. Fung. If you've used the Observe GP platform, you may remember me from video consultation 1. In this video, I'm going to answer some of the questions you've submitted to the RCGP. Firstly, I'll tell you a little bit about when and why we developed this platform. It was a massive project which took around 11 months to complete, and it involved discussions with lots of different people about what should be included and what would be most useful for you. I know, and the RCGP knows, how difficult it can be for aspiring medical students to gain the relevant work experience. This has been a problem for a really long time, and the college wanted to create an alternative to work experience which is accessible to everyone, but also in many ways can provide more insights than what you would normally gain from work experience. The role of the GP is also not fully understood. Hopefully, having completed the platform now, you have an increased knowledge of how crucial general practice is to the NHS. We hope that with this greater understanding, more young people such as yourselves will aspire to become GPs. It's our way of helping you to make an informed choice about your future. A lot of you wanted to hear more about the challenges of being a GP, so I'm going to explain some of those, but mainly focusing on our time before COVID-19. So in general practice, the variety of the patients we see and the variety of the conditions we see is absolutely enormous. If you are a surgeon, for example, what you do every day, job-wise, can be quite specific. If you're a midwife, the patients you see can be quite specific. However, in general practice, it's just incredibly broad. One moment you could be with chronic illness, the next grief, mental health, infection, cancer, disability, social problems, financial problems. Literally anything can walk through that door. And it does take a particular skill set and mindset to deal with that every day. And some days the challenge can be quite considerable. We also received a really good question about what we do when the patient's angry. This actually doesn't happen as much as you think. And if it wasn't for the questions you asked, I probably wouldn't have considered it a challenge of my role as a GP. So we occasionally do get angry patients, but we're trained from very early on in medical school in how to manage these situations and how to de-escalate it. Our job is essentially to stay calm, to listen to the patient, to hear their concerns, and to figure out how we can help them. Often when patients are angry, they're angry for a reason, and it's important to remember that we're on the same side, that we're there to help them solve their problem, and we want the same thing. However, if there were a situation when they were angry at me, we apologize and we figure out how we can move forward. One aspiring medical student asked us why we didn't include a video on Observe GP with an angry patient. This is something we're thinking about for the future, and it will take a little bit of time and consideration to get it right and make sure that it reflects something that's realistic. Like in every job, people find different things stressful. Everyone is different and every GP is different. For example, I don't particularly mind paperwork so much. There can be quite a lot of it and it's incredibly important to get right, but it's not something that I've found particularly challenging or particularly stressful. This isn't true of my colleagues, for example. Some of them can find it very challenging to write lots of letters or do loads of referrals, for example, and they can find admin quite burdensome. But I guess the reality is, in any job that you take in future, admin's going to be a part of it, and actually it's really important to get it right as a healthcare professional. What is interesting, however, is how technology is improving to help us with this side of the job and what it can then do to make us more efficient. What I personally have found challenging is consultations running over time. So in my consultations, I could be in a room with a patient looking after them, but knowing that I'm running over and there are patients outside in the waiting room waiting for me, I can find quite stressful. Thankfully, a lot of people are quite understanding of this, and they know that if I've not called them in at the exact time of their scheduled appointment, I'm probably with another patient and dealing with them. What really helps in this situation is having a rapport with the patient and having that relationship where you know them and they have an understanding of how you work as well. Some GPs can handle this really, really well, and they can compartmentalize and just carry on, not worrying about who's waiting outside for them, focusing on the patient in front of them at the time. For me, I find it a little bit harder. Another thing that some GPs can find quite challenging is the 10-minute consultations. It can seem really, really short. But as trainees, we do get eased into this. We all start on 30-minute appointments, and you see your patient in that time, and that gets slowly reduced down to 20, 15, then 10. At first, it can seem like you would never be able to bring your times down, but eventually you do. It just comes with practice and understanding how to do things more quickly and more efficiently. It is undeniably challenging, and some practices have mitigated for this in various different ways. Some are offering 15-minute appointments, or others are doing sort of triage calls before you invite them in for face-to-face appointments. So there are different ways around this, and there are different ways of doing things as well to make it work for you. Another thing that GPs can find quite difficult is the uncertainty that we deal with. It's not necessarily a challenge, but more a reality of the job. We talk a lot about uncertainty on the Observe GP platform. As a GP, you might not have all the tests available to you and to your patients, and you don't always know all the answers. Sometimes you just have to make a decision based on the information that you have because you can't get more information, and that is the reality of the job. And it does take a lot of time to learn how to develop those skills and to recognize when things aren't right, but also to learn to have the confidence to know when waiting is appropriate. There is some risk with developing these skills and having how to explain this to patients and how to reassure them with that. That skill around risk management is often underestimated. People may be very understanding of how secondary care works and how they manage risk in terms of all the tests and results they have available to them. But in GP, sometimes we have to realize that over-investigation and over-treatment might actually be harmful to the patient. And part of our role is to ensure we do the right thing at the right time. And that isn't always a referral or a test or treatment. I just wanted to end this video by saying a massive thank you to you all. The feedback we've received about the Observe GP platform has been absolutely awesome. It's been so positive and so kind, and all of us involved are so grateful for your support. The theme of the next video that the RCGP are going to be releasing is around the challenges that we've faced, particularly around COVID-19. I hope that you found this video helpful, and I wish you all the best for your future applications to medicine.